Your doctor probably told you that sildenafil is Viagra and Tadalafil is Cialis and asked you which one you want, right? Well, there are three key differences between the two medications that probably not even your doctor knows. And if they do know, they certainly didn't take the time to explain it to you. But don't worry, I got your back. The first difference that we're going to talk about is rather serious. We're going to talk about the different side effect profiles of each medication. Now, to understand the different side effect profiles, you first have to briefly understand how the medications work. Both medications are known as PDE5 inhibitors. What is that? It inhibits an enzyme known as photodiesterase enzyme 5. That's the enzyme that breaks down cyclic GMP in the corpus cavernosum, so part of the penis. When you inhibit it, nitric oxide signaling lasts longer and smooth muscle relaxes, and basically it helps you get an erection, right? So that works the same in both medications. What is not the same is that while they are blocking PDE5, that's not the only ones that they target. And they both target different ones in sort of an ancillary or accidental way, meaning this is not ideal. So sildenafil also targets one known as PDE6, which is located in the eyes. And that is exactly why some men on sildenafil have rather serious complications with their vision. They might get a blue tint or blurry vision. Basically, you'll know probably if this is happening to you because, well, quite frankly, you won't be able to see very well, and that can be really scary. And that comes from sildenafil targeting PDE6 when it's really designed to only target PDE5. Tadalafil does something similar, but with an enzyme called PDE11, which is in your liver and your testes and your joints. So if you're experiencing joint pain, lower back pain, hip pain, these sorts of things on Tadalafil, that may be what it is. And again, that's just an accidental consequence of Tadalafil in some men. Now, the reason why you need to know this is that some people take something like a sildenafil, they have a side effect and they swear off PDE5 inhibitors, when what potentially they should be doing is asking their doctor about switching to Tadalafil. Likewise, if you take Tadalafil and you're having bone pain or joint pain, these sorts of things, don't just swear off PDE5 inhibitors if you need them. Talk to your doctor about switching to sildenafil. And of course, that's really simple at something like Shameless Care. You just send a text message to your doctor through our system, and in a couple of minutes, the whole thing's taken care of. But it might be a little different in your situation. But nonetheless, you don't want to just do without treatment for these reasons. The next one we're going to put together, and that is how sildenafil and Tadalafil are impacted by food and how long they last. I'll make this as simple as I can. Sildenafil is terribly impacted by food, and Tadalafil is basically not at all. So if you're the kind of person that likes to go out to eat before your dates, and then you notice, this pill doesn't seem to be working quite as good tonight as it normally does, I would say you can pretty well be assured that food is the culprit in that case if you're taking sildenafil. But if you're taking Tadalafil and experience that, then it might be something else because according to the scientific research, food does not impact Tadalafil really at all. The other thing to realize about these medications is timing. Sildenafil typically lasts about 8 hours, and Tadalafil typically lasts about 36 hours. Now, when most men hear that, they think, well, why wouldn't I just take the longer acting one, right? Just like when you have a headache and you go to CVS, you always get the extra strength Tylenol, at least if you're like me. Like, why get the regular when you get the extra? Why get the short acting pill when you can get the longer acting pill? Well, if you're younger and relatively healthy and maybe you're using ED medication because you get nervous on dates or using condoms or that sort of thing, but you really don't have like a vascular reason for ED, then when you take Tadalafil, you might find it, believe it or not, a little bit annoying the next day when potentially you're getting erections very easily from things that would otherwise not cause it, like your gym shorts rubbing on your penis, things like that, or being erect in situations where there's no opportunity for sex. On the other hand, for men who like a lot of spontaneity in their sex life and they really want to be medicated all of the time so that they're always ready to go and they don't want to have to remember to take a medication before sex, then Tadalafil is really the obvious choice. So that's the difference between the two on food and then also on timing. Now, if we were sitting down at a bar and having a drink and you said, Robert, you own a company that's prescribed these medications to thousands of men. What do men say about them? What are the practical differences when you're just living your life as a man, trying to keep the wife happy, trying to have a great sex life? Like, what are the differences? Well, I can tell you that it's probably 2 to 1. Most of our patients prefer sildenafil, and most patients select 50 milligrams of sildenafil. So, sildenafil typically comes in 25, 50, and 100. It should be no surprise that the middle ground is the most popular. That seems to be enough medication for most men without getting ridiculous side effects like extra congestion and things like that. 50 milligrams of sildenafil, far and away the most popular dose. And we charge the same amount of money for all of our medications. So there is no price reason for people to choose that. It's not like that's the better value. That's just what they prefer because there's absolutely no reason to be over medicated. Why are men choosing that over Tadalafil? I think that for a lot of men, sildenafil feels like it hits you hard. Like you're going on a date, you go to the restroom, you're washing your hands, you reach in your pocket, you pulled out a sildenafil and you take it. And you can pretty well be assured that in 30, 45 minutes, you're going to be raring to go. It kind of comes on fiercely and you can feel it in a way that is hard to really describe, right? Like for me, it just makes me feel a little bit flush. I like the feeling of being medicated from the standpoint of like, that gives me confidence as a middle-aged man. It gives me confidence knowing that, yes, it's in my system and we're ready to go. And I think just anecdotally, a lot of men like that as well. The men who like Tadalafil often take it every single day. Some of them use it for other perceived health benefits, and there is starting to be more and more research about that. I'll spare you the details on that right now, but those are really the differences between the two medications. Now, what's becoming more and more popular are men using compounded medications that are a mixture of the two. So kind of a best of both worlds, sildenafil and Tadalafil. And we have one of those called Shameless Duo, which you can find at shamelesscare.com. Hey, we're trying to build our YouTube channel over here so that we can help people. If you have any questions at all or comments, leave them down below. If you could drop us a like, I would appreciate it. Like I said, we're grinding, trying to get this thing going, and appreciate all the help we can get. Till next time.